want to inspire people, especially the patients that look like me and I take care of every day, that it's okay to get vaccinated. It's safe.
It's momentous. I feel honored to receive it, humbled to receive it. It's a really wonderful day.
It is such a moment of hope because we can see the light.
You heard it, a moment of hope, but also just so many emotions from coast to coast as COVID-19 vaccinations begin. The same day, our nation hits a devastating milestone, 300,000 COVID-19 deaths. So this morning, healthcare workers who got the first vaccines are stressing, please continue wearing masks, continue to socially distance, and we really have to do our part to fight the virus.
Yes, that's because the majority of the general public not expected to get the vaccine until springtime, probably like April. 2.9 million Pfizer doses will roll out this week, with an additional 2.9 million next week, and then 20 million by the end of the year. Nursing home residents are expected to start receiving the vaccine next week, and as many as 6 million doses of the Moderna vaccine could be shipped out on Friday if the FDA approves that one. So now here at 7 o'clock on this Tuesday, we have team coverage tracking the vaccine. Gina has a timeline of who will get vaccinated and when.
And Susan is joining us with some of the scams that are happening right now related to COVID-19 that you need to be aware of. But first, we begin with Ernie, who is live with more information on who will be vaccinated first in Arizona.
Yeah, a number of drive-through sites have been set up like this one here at Honor Health to get those first phase of people vaccinated. And I'm told an operation like this could vaccinate about 1,000 people in a day starting on Thursday. Like you mentioned, those first vaccines coming in yesterday here at Honor Health. That's 2 boxes made by Pfizer and its German partner BioNTech. Now, each of those boxes contain 5,000 doses with vials stored in special freezers at extremely cold temperatures. Now, some of the first people to be vaccinated will be frontline healthcare workers, first responders, and those most at high risk and over the age of 65. And we actually spoke to Scottsdale Fire Chief Tom Shannon, who says he wants to be one of the first to get the vaccine this coming Thursday.
We're sworn to serve, and we're sworn to do everything we can in our power to protect. And so if there's something that we can do to ourselves to make ourselves ready, make ourselves healthier, we should do that, in my view.
Now, Chief Shannon's department actually had 70 people test positive for COVID-19 out of nearly about 300 staff members. Right now, he's urging other first responders to get the vaccine so COVID-19 doesn't run rampant in their departments and they can continue to protect the community.
Is that we should be doing everything that we can do to help keep the public safe.
Now, those in the first phase to actually receive the vaccine should have been contacted and received information on how to make an appointment this Thursday, as well as those at risk should also be contacted. Reporting live, I'm Ernie LeBeau for Arizona's Family.
Ernie, thank you. We want to head over to Gina now, who's joining us with a look at Maricopa County's vaccine priority overview. And where do we land, Gina?
Yeah, well, phase 1 is underway right now. That's what we're in, and as we speak, it will start with healthcare workers, emergency medical service workers, and long-term care facility staff residents. So the next group includes adults in settings of big gatherings, law enforcement, teachers, and child care workers, as well as essential services and critical industry workers. Then adults 65 and older and adults with high-risk medical conditions. The second phase includes the general population, but those vaccines not expected until at least the spring of 2021. That's the plan for Maricopa County, but the timeline for vaccinations will vary across the rest of the state, and then, of course, state by state across the country. This month, the CDC wants the states to give their limited supply of doses to 21 million healthcare workers and 3 million people living in long-term care homes. Also, the FDA actually meeting on Thursday to review emergency approval for Moderna's vaccine. And looking ahead, the FDA will review vaccine trials from AstraZeneca and Johnson & Johnson sometime in the next month. Assuming Moderna's vaccine receives approval, Americans could see 50 million doses in January, 60 million doses in February. By the end of March, 150 million doses will have fully vaccinated 75 million Americans because, as you know, each person has to have 2 doses of the shot. 75 million may sound like a lot, but let me show you the breakdown of the groups of people considered priorities for a vaccination. So the United States has 21 million healthcare workers, 3 million nursing home residents, 87 million essential workers, 100 million considered at risk with something like diabetes or asthma, and then 53 million seniors. So millions of doses, as you might imagine, will go quickly, Olivia.
Gina, thank you. So as we head into the largest vaccination effort in U.S. history, we obviously have a lot of questions.
We sure do. So Dr. Michael Kinch is joining us right now. He is the Associate Vice Chancellor and Director of the Center for Research Innovation in Business at Washington University in St. Louis. So, Doctor, good morning. We appreciate your time this morning.
Well, thanks for the opportunity to come.
Dr. Kinch, lots of questions, so let's get right to it. One of the big ones is, when would immunity kick in once you're vaccinated? And we know this is unusual because you require a second dose. So what if that dose isn't timed appropriately, or what if it's skipped altogether?
Well, so the early evidence suggests that what you really need to have is 2 shots. And generally speaking, probably about 3 weeks after your second shot, or roughly 2 months after your first shot, is when you should really have full immunity beginning. And that immunity should last for a long time. We don't know what happens if you only get 1 shot. That has been discussed because of questions about the availability of the vaccine. And so I would say that the safest thing that most public health agencies are doing is to say, get your 2 shots, make sure they are properly spaced. One of the vaccines requires 3 weeks between vaccinations, the other 4 weeks. So it's going to really depend upon which vaccine you receive as far as either Pfizer or Moderna.
Thank you, Doctor. We do have a caller on the line, actually, so hopefully we've got Maureen here from Scottsdale. She has a question for you. Maureen, can you hear us?
Yes, I can. Thank you. Good morning. Thank you for taking my call. I recovered from COVID, so presumably I already have some antibodies. I plan on taking the vaccine. Will the vaccine's efficacy be more, less, or the same for people who've already had the virus? And were COVID survivors included in the vaccine studies?
So COVID survivors were probably not included in the vaccine studies because those studies began in July. And for the most part, they were people that had not tested positive in the past for coronavirus. And the reason for that is that they wanted to make sure that they could distinguish what the vaccine had when it made a difference in your immunity versus what you had coming in. Now, to answer the bigger and more important question, those folks who've had COVID in the past, there shouldn't be any negative side effect to having the vaccination. And actually, I think it's a very good idea for everyone who has had COVID to also be immunized here. And the reason for that is that we know that with natural infection, in some people, it appears that you only get a very temporary immunity. And what you really need to have is a much more long-term immunity, which you're going to be able to hopefully get from that vaccine.
Maureen, thank you for your call. Hopefully that helps. And we also posted to our AZ Family Facebook page asking, what do you want to know about the vaccine? So Clifford Bagnanov wants to know what the long-term side effects are. I'm sure a lot of people want to know that, Doctor.
We all want to know what those long-term side effects might be. Frankly, we don't know. There is no reason to believe that there will be long-term side effects, but it's not impossible that that could happen. That is one of the issues with having a vaccine so efficiently delivered, is that we unfortunately don't know what the long-term impact will be. But again, with the vast majority of vaccines and immunizations, you see that the effects generally tend to be very short term. And that's actually an important point. to make, which is that if you feel a fever and feel kind of lousy a day or two after you're vaccinated, that's a good thing. It means that the vaccine is working. It does not mean that you have COVID. That a lot of times is confused with influenza vaccines. Right. That people will say, "Oh, I'm feeling bad. It caused influenza." Real influenza and real COVID is far, far worse than what you get after a vaccine.
Okay, well, that's good to know. Dr. Kinch, thanks for your input this morning. We really appreciate it.
Thank you.
Stay safe. Now that the long-anticipated COVID-19 vaccine is being distributed in Arizona, federal officials are warning consumers to watch out for scams, Olivia.
It's always sad that people take advantage of a time of crisis, right? 3 on your side, Susan Campbell standing by from the newsroom with more on how to spot these criminals trying to capitalize on the vaccine, also in this pandemic in general.
Yeah, scammers always prey on current events and emotions. Right now, they may be banking on people being desperate to get the COVID vaccine. So the Federal Trade Commission has a couple reminders. You can't pay to get yourself on a list to get the vaccine, and you can't pay to get early access to it.
The COVID-19 vaccine is here. The first doses of the Pfizer shot arrived in the Valley Monday morning. The threat of scams arrived with it.
The potential scams that may be out there are basically paying to get your name at the top of the list or early access to the vaccine.
The Better Business Bureau's Tiara Terry says you should just ignore any calls or texts or emails asking you for your financial information in exchange for the vaccine. Remember, Governor Doug Ducey said Arizonans who want the vaccine will get it for free.
Anybody who's calling your phone, asking you for personal information, especially banking, credit cards, any form of payment methods you pay for the vaccine, it's a scam.
The Federal Trade Commission is also cautioning consumers to be careful. The agency says no one from a vaccine distribution site or insurance company will call to ask you for your social security number or other personal information to sign you up to get the vaccine.
If you get any suspicious calls or texts about the vaccine, you should report them. We have a link right now on our website, azfamily.com.
Good information, Susan. Thank you. We've got the stories that you just saw, plus more answers about the vaccine from doctors on our free AZ Family mobile news app.